Madam Chair, I also rise in opposition to this extremely bad amendment. It seeks to cut funding from the UNFPA and funding for family planning in all global health programs. Are you kidding? Really? This amendment hurts the most vulnerable women in the world. Why would anyone want to do that? And you're doing it with misinformation about UNFPA. There is an obsession on the other side of the aisle about a lie. UNFPA has nothing to do with forced abortions in China. Please, I mean, enough with it, enough with it. Let me tell you about UNFPA. It provides critical health care services to women and girls in over 150 countries around the world. In this past year alone, supported the safe, healthy delivery of 1.5 million newborn babies in places like Ukraine and Ethiopia. Now, if my colleagues on the other side of the aisle are really concerned about protecting life, this sure sounds like an organization you would want to fund. And here's what else UNFPA does. It provides health education, access to modern contraceptives to millions of women globally. It supports efforts to end child marriage. It works to prevent teen pregnancy complications. And listen to what it's doing in the war in Ukraine right now. To respond to the soaring humanitarian needs in Ukraine, UNFPA is coordinating and bolstering life-saving reproductive health services and protection response services for survivors of physical and sexual violence. Just recently, more than 13 metric tons of reproductive health supplies were delivered to 7 hospitals across the country, along with 27 tons of critical reproductive health supplies and medicines. Listen, I could go on and that, and they're helping the women in the countries that they're fleeing to. But, you know, it's not enough for my colleagues on the other side to want to slash the funding to UNFPA, which is really, I would say, one of the best humanitarian organizations in the world. But now you want to slash funding for critical family planning, which would put the health of millions of people around the world at risk. You know that there's at least 218 million women who want to avoid pregnancy in low and middle-income countries who don't have access to contraception. And listen, this family planning helps people get the health services and the health care they need to take care of themselves. So when you cut the family planning, you know, other than just making this absurd, extreme political statement over there on the other side of the aisle, what you're going to do is add to maternal mortality. You're going to add to forced pregnancies with devastating consequences. I'm not going to go through the whole list. There's lots of them. Listen, in the end, this is what I want to say. For women deserve to be healthy and in charge of their own lives. And this amendment is extremely bad. Vote against it.